Good morning, everyone. I'll be presenting on my paper, In Vivo Imaging of Schlemm's Canal in the Management of Juvenile Open-Angle Glaucoma. I have no financial disclosures. So, in JOAG eyes, it has been seen that on gonioscopy, angle distances could exist in the presence of high iris insertion and iris processes, and these eyes have been seen to respond poorly to selective laser trabeculoplasty and medical management. Our group has also previously seen that in those JOAG eyes which have gonioscopically normal angle, some form of angle distances may exist on ASOCT, and these eyes, when undergo selective laser trabeculoplasty, they show failure. How this angle distances is seen, I'll be talking subsequently. So the objective of the present study was to evaluate the presence of angle distances on ASOCT as a predictive factor for overall management of JOAG eyes. It was a prospective clinical cohort study with 18 months follow-up. Only those JOAG eyes were included that had no angle distances on gonioscopy. Angle was evaluated on ASOCT, STOCT machine. They were divided into two cohorts in which distances was present or absent. Both these cohorts initially received medical therapy, and in those eyes which showed failure, they underwent filtration surgery. So how the angle distances was identified? We used an STOCT machine with modified angle module using the enhanced depth of imaging. Overall, only 50 B scans, that is 30 degrees of angle, was imaged. 25 B scans, 15 degrees, that is, each in nasal and the temporal quadrant. It was assessed by 3 blinded glaucoma specialists, and angle distances on ASOCT was defined as an absence of Schlemm's canal or a presence of hyperreflective membrane. It is to be noted that a Schlemm's canal should have been present as a hypolucent space and at least 2 consecutive B scans to differentiate it from any artifact. We also, one single blinded glaucoma specialist also tried to quantify the amount of angle distances by counting the number of EDI ASOCT B scans in which Schlemm's canal was seen. So on the left-hand side panel, you can see the normal morphology of Schlemm's canal. On the right-hand side, in the upper corner picture, there is no Schlemm's canal, and in the lower one, there is no Schlemm's canal along with presence of a hyperreflective membrane. Overall, 66 eyes were recruited. The angle evaluation, the agreement between the 3 observers was good. Overall, 35 eyes had success on medical management and 31 required surgical therapy. Of those eyes which underwent surgical management, they had a younger age at onset, they had a more severe disease, the baseline IOP was higher, and had a higher vertical cup disc ratio. All these, the last 3 parameters were statistically significant. When Schlemm's canal was identified on any 2 consecutive B scans, 72% of the eyes showed success on medical management. When we quantified it as presence of Schlemm's canal on more than 50% B scans, 90% of these eyes showed success on medical management. All the 11 eyes in which hyperreflective membrane was present, they showed failure. So this graph shows that eyes which had angle distances in any form, either absence of Schlemm's canal and or presence of hyperreflective membrane, needed to undergo surgical management. On regression analysis, the only significant factor was that the presence of Schlemm's canal on ASOCT increased the odds of success of medical management by 2.9 times. So I would like to say that the absence of Schlemm's canal on ASOCT is a strong predictor for failure of medical therapy in JOAG eyes, and these eyes may be considered for trabeculectomy. The clinical relevance is that this can help us not only in clinical decision making but also in prognostication and patient counseling. Well, based on the previous 2 studies and this studies, our group came up with this treatment algorithm for JOAG eyes, where we say that those eyes which have gonioscopically present angle distances or those eyes which have angle distances on ASOCT, they may be considered for surgical management and the patient may be counseled regarding the same. And those eyes which do not have any angle distances in gonioscopy and on ASOCT, they should respond better, they should respond well to medical management. The limitation is that acquiring high resolution scans in these eyes is difficult, especially if the patient has poor vision. Also, ideally a 360-degree angle should have been imaged. However, we saw that 30-degree angle was also correlating well with the results. We did, however, do imaging of the 360-degree angles in 4 eyes, but it took almost 2 hours per eye to do that, so it was inconvenient for the patient. Thank you.
Thank you.
Ma'am, we 75 eyes were there. 75 patients were recruited initially for the study, out of which 9 had to be excluded because we were not able to get good pictures in them. Only 9.